Hi, I'm Samantha Shaw. I'm the Head of Audit and Risk at Cleanaway, and I've been here for 2.5 years. And I'd like to introduce you, at an appropriate social distance, of course, to my colleague.
Hi, I'm Rachel Evide Marshall, Cleanaway's Head of Health and Safety, and I've been with the organisation 13 years. So the first I heard of COVID-19 was through the media, and we started very early on to get queries through the safety team from both employees and from customers. And Sam and I would have many conversations around how we were going to start to respond to our employees.
Yeah, so the primary conversation that Rachel and I were having was about maintaining the safety of our staff. Obviously, that was coming through very strongly from the safety team. And as it arrived in Australia, the queries started to continue. And at that point in early March, where there had been one fatality in Australia, I think at that time there were 33 confirmed cases, we agreed with Michael Bock and Joe Bergeson that we needed to form a response team to deal with the queries and make sure that we had a consistent approach for our staff, for our customers. So at that point we brought in HR as well, and we formed a regular team where we met on a daily basis. The first thing that we really needed to do was to develop up our emergency management plan for a pandemic. It wasn't something that we had in place, so we really needed to start that from scratch. And the paramount consideration was protecting the safety of our employees. So the emergency management plan really came together. It was quite fluid because things were changing very quickly. So what we initially did is we structured our daily discussions around what the recent government advice was saying, how we were seeing our staff and employees impacted, how our customers were being impacted, so what information was coming through from our customers. We were looking at our HR impacts. We were looking at our comms strategy, because that was a critical piece of what we did. And we were also looking for ensuring we were prepared from a safety perspective. Rachel, perhaps you could go into a bit more detail around the safety piece.
So from a safety perspective, early on through our health business, we engaged an infection control specialist who was really able to guide us through the additional controls we needed to continue to provide our essential service. So we were able to look at things like, how do I clean my truck? What happens if I have to have 2 people in a truck to do a heavy vehicle driver assessment? How do I conduct meetings at Cleanaway? Should I still have visitors come to the office? So we were able to use and work through the government advice and how we apply that across all Cleanaway tasks, and then harness our existing systems to build those controls.
So the next stage we needed to do was to implement the emergency management plan across the business. So we helped the business by running workshops to identify all the risks and thinking that they needed to put in place in terms of responding to a pandemic. When we ran the workshops, we found that the business was already thinking about how they would respond and minimise the risks. So that was fantastic. They had already done an awesome job. So our role was very much around sharing that knowledge and those ideas across all the different strategic business units.
So one of the biggest challenges from a health and safety perspective was making sure that we secured the right PPE that we needed for the business, and that we're able to secure hygiene products such as hand sanitizer. And that really was a great challenge, because supplies that come internationally became scarce within Australia, and a lot of the supplies of those sort of products were used in the healthcare industry, where you'd expect that they would be prioritised, but that meant that many of our shipments were actually diverted, and that placed pressure on our current suppliers. So the business impact, if we weren't able to get those supplies, is it would have actually impacted just our normal business as usual PPE. So things such as P2 dust masks that we use in our transfer stations and on our landfills and other dusty environments, if we weren't able to secure those stocks, we would have to have closed those facilities.
The most challenging part of the process for me, I would say, was twofold. One was the fluidity of the issue that we were dealing with. So this, everybody talks about it being an unprecedented event, and it certainly is. So it was something that really none of us had dealt with before. And it was happening quickly, so we needed to move fast and respond fast. And that leads me to the second biggest challenge, and that's around communications, because it was so important that we communicated to all our staff and all our contractors as well. So having clear communications to everybody was a challenge, because not everybody has email, not everybody has access to the portal. So we needed to make sure that our comms got to everybody.
So that's right, Sam. Initially, we started by using our traditional methods of communication, such as toolbox meetings, but realised very early on that having large numbers of people in a small room wasn't going to meet the requirements of social distancing.
That's right. So we developed a query line, so an email where everybody could send in their queries, and we used that as a FAQs that we answered on a daily basis and updated on a daily basis. That was all printed out and sent to each of the sites every day, so that people could keep up to speed with the messages that we were sending out. And really, that was a response to the questions that were coming in from right across the business. The other thing that we did was using our text messages. And that was another way to ensure everybody that the FAQs had been updated and that there was new information available to have a look at.
So what comes next? We've now started to move into planning for bringing everyone back to work.
Yeah, and I think the important thing here is that we will continue to follow the guidance of the Australian government and the health professionals. But whilst we have seen that the numbers have reduced, we are starting to plan for returning to work.